Well, the Aig-Imoukhuede Foundation is working to revitalize primary healthcare centers across Nigeria. Through its Adopt a Healthcare Facility program, the foundation is working to bridge the healthcare accessibility gap and reduce preventable deaths. The program was launched to revitalize a primary healthcare facility in each of Nigeria's 774 local government areas to provide low-cost health services to the poor and vulnerable at reasonable standards. It hopes this initiative will significantly improve access to quality health care, particularly for vulnerable populations, including women and children. Well, I'm now being joined by the Director of Programs at the Aig-Imoukhuede Foundation, Chioma Njoku. Thank you so much for being on the news tonight.
Thank you for having me. Good evening.
So the focus is revitalizing the primary healthcare centers across the country. This is an ambitious project, adopting primary healthcares and revitalizing them. What inspired this ambitious project by the Aig-Imoukhuede Foundation? And if you can tell us how it's going so far.
Well, like we all know, the Minister of Health said, without health, there is no hope.
Yes. Right.
So Nigeria has about 30,000 primary healthcare centers across the country. And shockingly, only about 20% of that is functional. And that's an emergency. And so we also understand that because of the depth of lack of capacity currently existing, it's a humongous task to leave it in the hands of only the government. And so it's left to us as Nigerians, as private sector, non-profits, to step in and try to close that gap. So what the foundation did is to collaborate with the Private Sector Health Alliance of Nigeria, PSHAN, on this project, ADHFP, to ensure that at least one PHC in every local government is functional. As a foundation, we have adopted 23 primary healthcare centers, 19 in Edo State, and 5 will be adopted across the country.
Okay, so you've adopted 23 so far. Are they fully revitalized, all of them? And what are the immediate impacts you've observed in these ones you have adopted?
So we just concluded the first phase, which is revitalizing 4 in Edo State. And what we've seen so far is the joy, you know, in both the beneficiaries and the health workers who work in those primary healthcare centers, right? So before we got to those areas, some of the health centers did not even have fences or doors or equipment, even benches for people to sit on, right? But then we have people who have gone there, revitalized the building itself, brought in staff, supplied reusables for medical reusables and equipment, and now those PHs are functional and serving their communities. Interesting.
One would wonder, infrastructure like you've mentioned, staff training, essential drug supply as core of what you're doing. What's been the biggest challenge for adopting a primary healthcare center by your foundation?
Accessibility. So it's one thing for a PHC to be in a locality, but sometimes local governments are large. For people in the community to get from their homes to access those PHCs can be a daunting task, right? So ensuring that the road network is in good shape for them to actually access these healthcare facilities is important. Also, the availability of healthcare personnel within these facilities is also a very big incentive for those people in the communities to access them. And so we don't work by ourselves. Of course, we work with the communities, we work with the Edo State Primary Healthcare Development Agency to ensure that while we are bringing in the equipment, and training people and all of that, they also play their part with the joint partnership to ensure that this prospers.
When you talk about primary healthcare centers, they are like the basics of the pyramid in healthcare provision in Nigeria. And when I hear you say accessing them is a challenge, despite the numbers of centers we have across the country, then that raises a concern, because the whole idea of a primary care health center is to be close to the people. So is it a problem of not having enough, or what exactly is it?
Well, we definitely don't have enough. Nigeria has about 200 million people. 30,000 is a drop in the ocean. However, even the ones we have should be functional. And so what we're saying is one PHC in a local government, depending on the size, is really not sufficient. But let's start from there, right? Let there be at least one functional one that people can find their way to, as opposed to having none.
I also see that you're calling for community nominations for these PHCs in need of urgent revitalization. So how do you ensure that the communities are fully engaged in this process? And why are you calling for nominations? Is it that you don't know where they are?
Okay, so like I said, we've adopted 19 in Edo State, one in each of the 19 local government areas. And the remaining 5, you know, it's as our way of ensuring that Nigerians are carried along. Because as Nigerians, we all don't feel happy with the current state of healthcare provision. And so we are saying, okay, instead of just complaining, you can be a part of this. So we've put the call out. It's open till the end of the month, 31st December, on our LinkedIn pages and our social media handles. And there's a link for you to click on, the Aig-Imoukhuede Foundation.org/ADHFP. You click on it and you fill your profile, you take a picture of a PHC, you upload it, and you tell us why you're nominating that primary healthcare center. What is the gap that you're seeing there, and why does that PHC require our help at this time? Why are we doing this? To ensure that Nigerians are involved, right, in the development of their own country. Advocacy, you know, and being an owner in building the country is very important.
What do you say to Nigerians watching this program tonight? Yes, it's important. First, let me ask you, since you put up that post for people to nominate, what has been the acceptability of it? Are people responding? And what's the most mind-boggling you've seen about a PHC that they've sent?
Well, we've not gone to the final collation point at this time because this is just 3rd, 4th of December. We have over 20 days to go. So we are still allowing people to send in their nominations. But at the end of the nomination, when it's closed, we then look at the submissions and look at which PHCs have the highest, you know, nominations, what are the gaps there, and then we begin to close those gaps. And the top 5, the 4 PHCs that we're going to work with will be publicized to let you know, okay, you chose these PHCs and you've identified these problems, and we're going to work with you to get them fixed. And we'll be sharing updates as we go along.
Do you want to let us know the things you'll be looking at for to choose those top 4? Is this something you want to share with us?
Yes, definitely, because we have criteria for even the ones we've selected. So, right, where there are not facilities, infrastructure, right, where people go to in the afternoon and there's no staff, where you go to and the buildings themselves are dilapidated, where there is no power supply, where there's no water supply. These are things that you go to and you cannot visibly access any service. Those are the kind of PHCs that we want to reach. If you're functional a bit, at least you have something. But when you go to local government area and there's not a single PHC to provide service, we want those ones.
So you're prioritizing the worst of the worst.
Yes, the worst of the worst, yes.
So you've spoken to Nigerians and how they should own this, because we cannot leave it for government alone, and Aig-Imoukhuede is doing its own bit. But what do you tell other organizations? How can they come in, or you don't need your help?
Of course, like I said earlier, we're partnering with the Private Sector Health Alliance of Nigeria. It's a coalition, right, of organizations that is driving this initiative, and there are other organizations also adopting healthcare centers across the country. But it's not enough. We have more, you know, a long way to go. And so we are requesting all other private organizations, non-profits, you know, high net worth individuals who have a passion for the country, right? Healthcare touches every single one of us. Nigerians say you are one sickness away from death, right? It's important for us all to put our hands on the deck and work towards developing these healthcare facilities.
Oh, thank you so much. You want to call out one more time where Nigerians can go and nominate that PHC? So on our website, Aig-Imoukhuede Foundation.org/ADHFP. On LinkedIn, we are the Aig Foundation. On Instagram, we are Aig Foundation. On Facebook, we are Aig-Imoukhuede Foundation. Thank you so much, Chairman Njoku, for being on the news tonight. We do appreciate it.
Thank you for having me.
Thank you very much.